I'll be 70 on that next birthday, getting back into the swing of things.
Thomas Frazer is a family man, a father, and a golf enthusiast who would enjoy time on the golf course with his son. But activities like this, along with cherished family time, was becoming more difficult to enjoy because of a common condition.
Well, I went to the emergency room in Redbud with severe abdominal pain, and the physicians there diagnosed kidney stones. And they asked me where I wanted to go, and I said, well, let's go to Mercy. And once I was at Mercy, the first doctor that could get to me was Dr. Patel's group. And he told me we had to go get the kidney stones surgically. And once he'd done that, he told me that you need prostate surgery bad. So it was fate.
Fate that led Frazer on this path into Mercy urologist Dr. J. Patel's office. Frazer would travel from his home in Redbud, Illinois, to Mercy Hospital South.
The prostate had grown so much like that, it was a difficulty urinating.
This is a symptom of benign prostatic hyperplasia, or BPH. It's a common, non-cancerous condition that impacts men as they age, causing the prostate gland to enlarge.
In the urethra, on the outer side of the wall, there's a thick tissue like a donut that sits around the urethra. That's the prostate growth. As the prostate gets bigger, it pushes the urethra closed. When the urethra is closed, the bladder has to work harder to push the urine out.
It may cause significant health problems, including irreversible bladder or kidney damage, bladder stones, and incontinence. The solution Dr. Patel offered Frazer is aquablation therapy.
Aquablation is a methodology using water pressure, high pressure water, to ablate or open up the channel of the urethra, which is being blocked by the prostate.
This is one of Frazer's follow-up appointments after the life-changing procedure.
Aquablation to help gentlemen urinate better, to be able to empty his bladder, to prevent kidney infections over and over again, incontinence, or backup of the urine to the kidney to cause kidney failure.
Doctors at Mercy became the first in the St. Louis metro area to perform the procedure using the Aquabeam robotic system.
Well, my question to him was, am I going to be the first guy that you ever done? And he said, no, he'd done a lot of them. And he highly recommended it.
The Aquabeam robotic system is the first FDA-cleared surgical robot that combines real-time, multi-dimensional imaging, automated robotics, and heat-free water jet ablation for targeted and immediate removal of prostate tissue.
Without any electrical voltage, that can cause increased risk of potency, incontinence, and tissue destruction from heat. It's as important not to destroy the tissue in the safe zone as it is to destroy the tissue that is causing the accomplishment of improve the urinary system. If you destroy it too far out, then you have leakage issue. Forming a borderline as to where to destroy the tissue and what not to destroy.
The map then guides the robotic water jet to remove the prostate tissue, avoiding critical structures to preserve sexual function and continence.
I have a TV screen for the ultrasonic machine. We have a TV screen for the video cystoscopic machine, and we're using the robotic program ultrasonically as to what to destroy, what not to destroy.
This is just marvelous. It's faster recovery time. In mid-June, we were doing the surgery, and by early September, I was hitting golf balls again.
Now, Frazer's quality of life is back.
I don't want to cheat myself. I probably feel like I'm in my 50s again. The urinary functions are probably to age 35. Sexual functions, probably mid-50s. You know, I don't think you could ask for a better outcome than what I had, and I owe that to Dr. Patel. And of course, whoever developed this procedure. This is just a wonderful procedure.
The experience for Frazer leading up to Father's Day 2025 makes him feel even more blessed.
Puts you in perspective of, you know, just how vulnerable we all are, but it also gave you hope that there's always, you know, something that can be right around the corner. It's going to make a difference.